In Singapore, 1 in 20 people over the age of 65 suffer from dementia, which is a widespread disease among the elderly. Contrary to popular belief, dementia not only affects a person's memory, but also their behavior.
My grandfather from my mom's side has dementia. It was shortly after my grandma passed away, and he started having a urinary tract infection. So this caused him to, in a way, go gaga. He had to be restrained to the bed, and after that, well, basically he wasn't really himself after that. He would forget things really easily, and I still remember that he would always talk about money. His number one concern would be about money. Because from what I think, previously, he was very, very much attached to money. So this was a part of him that became very prominent, especially after he became a patient of dementia. When we go out, it was more of me looking after him. So in a way, like when I was young, he would actually look after me. So right now, it became reversed. So it was more like me looking after him. So, and right now, yeah, basically the conversation was all gone. Yeah. At first I was really, really sad because especially when he got the urinary tract infection and when he was screaming, it wasn't really himself, and he totally forgot my name. And yeah, because we were close to each other, and then imagine I was quite young at the time, and so it was quite a shock to my system. And then, yeah, I was really shocked that he didn't remember my name at all. And yeah, it was like talking to a person who wouldn't recognize you, basically a stranger who was supposed to be a very close companion of you. Yeah. Well, basically, I noted that he had changed. He was no longer my grandfather. Previously, I would actually play the guitar for him. So it'll be like new pop songs and all those you hear on the radio. So I learned simple chords and all that, then I'll sing for him. So after that, after he became a dementia patient, he still enjoyed it because I was playing it for him, and then he would just fall asleep. And for dementia patients, they would very much be very curt and very honest with you. So for example, if I play a song and it really sucks, my singing is totally bad, he'll be very honest and straight up say that it was not very good at all. Well, basically self-help is the most important, that's what I feel. So like the Singapore government wants us to upgrade our skills, so I simply upgraded mine. So I learned about how to deal with an Alzheimer's patient. So basically from the course that we went, it was a course basically only for teenagers like myself and youths basically. So by going for a talk like that, I realized that a lot of things that they mentioned, I was already doing it already. But yeah, it opened a few new perspectives and how things happen, the science and science of how it actually happens. And yeah, they showed very, very interesting videos, but in a way it was a bit late. So yeah, but who knows, maybe I may get dementia one day, or my parents also. We don't know.
Dementia is an illness. It is not normal aging. It is an illness where there is death of brain cells at an accelerated rate. As a result, there is loss of memory and personality change.
Well, the common one is that dementia only comes with old age. People always used to say that this is like an old-timers disease. But recently, if you look at some of the profile of our clients, some of them we are actually getting people like in the 40s, in the 50s. So it doesn't mean that as one age, one will definitely get Alzheimer's or dementia. But although the risk of dementia is as we become older, there's actually the risk of getting the disease. So there's a misconception that people with dementia are like crazy. Just because of often they have their own reality. They act in behaviors that are often odd or funny in our reality. We don't understand what their behavior is trying to tell us. We tend to say that they become crazy. And the third one is actually that when people are diagnosed with dementia, we often discount them as a human being. We don't think that they're still capable of thinking. We don't think that they're capable of making decisions or expressing what they want or having emotions. And all these are not true. For a person with dementia, and depending on the stage they're at, they're definitely still able to express what they want, communicate their choices, and definitely they actually have emotions and feelings.
Having a strong network of support and care for family who have dementia is very important. Youth constitute a central part of the family, and they are vital in helping to weave a compassionate framework of support and love. There are a number of ways youth can help out at home with a family member who has dementia. First and foremost, approaching parents and grandparents with respect, love, and patience is crucial to maintaining a pleasant relationship with them. Interacting and spending time with them is very important. Continue to engage them in activities such as playing chess, reading the newspapers with them, or something as simple as having meals with them. It is important to keep the focus on the process and not the result of each activity. The main goal is to spend quality time with them and keep the relationship fresh and enjoyable. Secondly, parents and grandparents should be taken for regular medical checkups. Dementia is often the result of another health issue such as depression, high blood pressure, or vitamin D deficiency. Youth can help them by accompanying their parents and grandparents for regular medical checkups and ensuring that they get sufficient exercise and consume a well-balanced diet. Making sure that parents and grandparents are healthy is a great way to keep dementia at bay. Thirdly, youth should do what they are experts at: surfing the net. There is so much valuable information on dementia on the internet. Youth can be the source of this information and help their families with accurate information of dementia, what it entails, how to prevent and treat it, and most importantly, who to approach for help. Last but certainly not least, talking to someone, be it a friend, teacher, or simply somebody close to you, will go a long way in helping to solve problems and maintaining a happy relationship with family members who have dementia. A great source of information and help is ADA, Alzheimer's Disease Association. The ADA is an organization founded in 1990 specialized in providing care to those who have dementia. Today, ADA has 4 daycare centers that offer care and support for the elderly with dementia. The 4 centers provide daytime nursing care, occupational therapy, physiotherapy, and social activities that can greatly help to relieve stress and time constraints felt by caregivers. They also have 1 caregiver support center to provide advice, information, and workshops to help caregivers take care of their loved ones.